A really simple technique that I use in clinic is this stirrup taping, and I want to go through so that you know how to do it, and for the practitioners out there, a bit of an understanding of why I do it as well. But what is it? It's a really simple taping technique that helps most people reduce their pain by spreading the pressure through their foot. And that's a little bit of the why. Really, we're controlling the foot motion. We've moved away from, that flattening foot or that hyperpronation type of terminology. That can be quite normal. But for me, it's how excessive or quick that force should be that is really important. We want to control and allow that force to be undertaken in a more managed, biomechanical movement. Okay, so it's really important that we start to spread that force a little bit better with our taping, reduce that force, but also start to give some nerve feedback. Think about this taping, in particular the type of tape that I use, as being like a really large ligament, giving your brain further neural or nerve feedback so that we start to feel where our foot's moving and therefore respond to it more rapidly, more appropriately. So what does it potentially work for? I find most conditions, because what we're doing is helping to spread and activate our foot more appropriately. And when our foot is activated more appropriately, we typically find that stress is reduced throughout the foot. That's always a good thing. Now, in particular, I do find that ankle sprains, heel pain, any forefoot discomfort, any overloading, any nerve entrapments, these are things that typically respond really quite well. Now, what should I use? I really like this Hyperfix tape. I find that it works really effectively because it's got a little bit of stretch, and also the 10 centimeters wide, because it's quite wide there, it allows us to wrap your foot a lot better. In saying that, you can use rock tapes and sports tapes and all that sort of thing. I just find this is definitely the best for what I am looking for. And then how do we do it? Well, let's have a bit of a look now on our video. So what I'm wanting to do is a really wide piece, a long piece, about 30 centimeters, and I typically wrap it initially to that outside or the lateral side of the foot before pulling it up really tight on that medial side or the inside. In this case, I've wrapped it around, I've smoothed it on, and there's not too many concerns there. Okay, and that's what I'm really looking at for when we're going through this. So what I'd say is try this at home, see how you go. If you're unsure, then come and see me. I'm more than happy to help. For the moment, that was stirrup taping of the foot.